Zoovet anesthesia scenario. I want to do something different today and talk through a scenario as if you are anesthetizing an African leopard. So your patient is a young male, let's say 2-year-old male African leopard, who just needs to be immobilized very briefly for a short, non-invasive procedure. Think half an hour, 45 minutes. Maybe you're in the wild and you're placing a radio collar. That's a good example. So you decide that you're going to use, for your short, non-invasive procedure, a combination of ketamine and medetomidine to dart your cat. Dart goes off perfectly. It hits right in the caudal thigh, semi-mem, semi-ten region, and your cat goes to sleep as well as you could have hoped. It is safe to get hands-on. You're doing what you need to do in terms of a procedure. And of course, you have anesthetic monitoring equipment on. You notice that the heart rate is trending down a little bit, but not rapidly and not to an extent that is dangerous from a cardiac perspective. What is that downward trend in the heart rate telling you about your patient's anesthetic depth? Keep your protocol in mind. What if I tell you that it's been 25, 30 minutes since the dart time? Now, what is that change in heart rate telling you about your patient's anesthetic depth? It should be telling you you better wrap it up or top up with more drugs, or you're going to have a very dangerous situation on your hands. Once your ketamine wears off in about 20 to 30 minutes, you will start to see a decrease in heart rate because the ketamine was keeping it elevated for you, okay? So as you're starting to see that rate fall, you shouldn't be thinking, oh, he's easing into a nice anesthetic plane. You should be thinking, my cat's gonna wake up quickly. And medetomidine is not enough to keep most big cats or carnivores in general down, okay? So you do not wanna be leaning on that alone, or you're going to have an awake leopard in a room full of people. Leopards are unique in that most animals' first instinct when they wake up, even big cats, is to get away. They might hurt you in the process, but leopards are intentional. They don't do flight when it comes to fight or flight. They are all fight, and it's a really dangerous situation if you have one wake up spontaneously on you. So if you have stuff that you still need to get done in that procedure, you better top up. Ketamine is a safe choice. You can always add more ketamine. Just know that that's going to prolong. You shouldn't recover immediately after you give the ketamine. You're now going to keep that cat down for a little bit longer while that starts to metabolize. Alternatively, the next time you immobilize a leopard, you could choose a different protocol. Something like K-BAM will give you a little bit more depth. Or if you have a procedure that's not going to be that quick or is going to cause a little bit of pain, you might want to consider adding Tilazol to your protocol. That's going to help you out a lot. P.S. Always intubate your patients. Leopards are more difficult than other big cats, but do it anyway.